Influenza, commonly known as the flu, is often mistaken for a mere inconvenience, right? A seasonal nuisance that brings on a few days of aches, fever, and fatigue. However, influenza is a serious respiratory illness that can have deadly consequences, particularly for young adults, older children, and those with underlying health conditions. The influenza virus is highly contagious, spreading easily through respiratory droplets released when an infected person coughs or sneezes. Symptoms of influenza can come on suddenly and can include fever, cough, sore throat, muscle aches, headache, and fatigue. While most people recover from influenza without much complication, the virus can lead to serious health issues, including pneumonia, bronchitis, and even death. Vaccination remains the most effective way to prevent influenza and its complications. Tuberculosis, TB, an ancient disease, remains a persistent global health challenge. Caused by Mycobacterium tuberculosis, TB primarily affects the lungs but can spread to other organs. TB spreads through the air when an infected person coughs or sneezes. Symptoms can be subtle and develop slowly, mimicking other respiratory illnesses. TB is treatable with antibiotics, but adherence to treatment is crucial. Without proper treatment, TB can become drug-resistant, making it much harder to cure. According to the World Health Organization, TB is one of the top 10 causes of deaths worldwide, claiming over 1.5 million lives each year. Hepatitis, an inflammation of the liver, can be caused by viral infections, alcohol abuse, and certain medications. Viral hepatitis, particularly Hep B and C, poses a significant global health threat. Now, these viruses, which are transmitted through infected blood or bodily fluids, can silently attack the liver, leading to chronic infection, cirrhosis, liver failure, and cancer. Vaccination for Hep B can prevent infection. Early detection and treatment are crucial to preventing serious liver damage. According to the World Health Organization, hepatitis B and C are responsible for 1.34 million deaths each year, making them a major cause of liver-related mortality worldwide. Chronic hepatitis C affects an estimated 71 million people globally, and many are unaware that they're infected. Hey, you're still finding this informational? Are you enjoying the video? Well, if you are, please subscribe and share with your friends. All right, let's keep on with the countdown. HIV and AIDS. A global pandemic transformed. The emergence of HIV and AIDS in the early 1980s sent shockwaves across the globe. This virus attacks the immune system, leaving it vulnerable to infections and cancers. Transmitted through bodily fluids, it spread rapidly among marginalized communities. The early years were marked by fear, misinformation, and helplessness. A global movement for research, advocacy, and support emerged. Scientists and activists worked tirelessly to understand the virus and raise awareness. Today, antiretroviral therapy allows people with HIV to live long and healthy lives. Despite this progress, around 38 million people globally are living with HIV, and over 680,000 people died from AIDS-related illnesses in 2020 alone. Continued efforts in prevention, education, and treatments are vital to ending the HIV and AIDS epidemic. Pneumonia. A deep breath can be deadly. Pneumonia, an infection that inflames the air sacs in one or both lungs, can be caused by a variety of microorganisms, including bacteria, viruses, and fungi. This respiratory infection can range in severity from mild to life-threatening, particularly in young children, older adults, and those with weakened immune systems. Symptoms of pneumonia can include cough, fever, chills, shortness of breath, chest pain, and fatigue. The air sacs in the lungs may fill with fluid, making breathing difficult and reducing the lung's ability to oxygenate the blood. Bacterial pneumonia is typically treated with antibiotics, while viral pneumonia may be treated with antiviral medications. In severe cases, hospitalization may be necessary for oxygen therapy and other supportive care. According to the World Health Organization, pneumonia accounts for 14% of all deaths of children under 5 years old, claiming an estimated 740,000 young lives each year. Vaccination, good hygiene, and timely medical care are crucial in preventing and managing this potentially deadly infection. Mumps. More than just swollen glands, mumps, which were once a common childhood illness, is characterized by the painful swelling of the salivary glands, giving sufferers the appearance of having a hamster-like kind of face. While this viral infection is often mild, it can lead to serious complications, particularly in teenagers and adults. Mumps can cause inflammation of the testicles, known as orchitis in males, which can lead to infertility. In rare cases, mumps can also cause meningitis, which is the inflammation of the lining of the brain and spinal cord, and encephalitis, which is the inflammation of the brain. Vaccination is the most effective way to prevent mumps and its complications. Despite the availability of a vaccine, mumps outbreaks still occur, highlighting the need for continued vigilance and vaccination efforts. According to the CDC, mumps cases in the U.S. decreased by more than 99% after the introduction of the mumps vaccine. However, there have still been thousands of cases in recent years, particularly in settings like college campuses where close contact facilitates the spread of the virus. Measles. A tiny virus with a mighty punch, measles, a highly contagious viral infection, was once a common childhood illness. Today, thanks to widespread vaccination, measles is preventable. However, outbreaks still occur, a stark reminder of the importance of maintaining high vaccination rates. The measles virus spreads with remarkable ease, primarily through respiratory droplets released when an infected person coughs or sneezes. Initial symptoms often mimic those of a common cold with fever, cough, and a runny nose. However, measles soon reveals its true nature with the appearance of a characteristic rash, starting on the face and spreading down the body. Maintaining high vaccination rates is crucial to prevent the resurgence of this potentially deadly disease. According to the World Health Organization, measles was responsible for over 140,000 deaths globally in 2018, mostly among children under 5. Even in developed countries, declining vaccination rates have led to the reemergence of measles, highlighting the importance of continued public health efforts. The sound of a child suffering from whooping cough is a chilling reminder of this highly contagious infection. Characterized by violent coughing fits, pertussis can be deadly for infants and young children. Vaccination has significantly reduced whooping cough cases, but outbreaks still occur, often due to waning immunity or gaps in vaccination coverage. Bordella pertussis, the bacterium responsible, releases toxins that paralyze the respiratory tract cilia, leading to the severe and persistent coughing spells. According to the CDC, there were over 18,000 reported cases of whooping cough in the United States in 2019, a stark reminder that this disease remains a threat. Booster vaccines are essential for maintaining immunity, particularly in adults who can unknowingly spread the infection to vulnerable populations, like infants. Norovirus, the notorious culprit behind outbreaks of gastroenteritis, often referred to as the stomach flu, has an uncanny ability to spread rapidly through populations. This highly contagious virus thrives in close quarters, making schools, cruise ships, and nursing homes particularly susceptible to its wrath. While not usually life-threatening, norovirus infections can bring about a symphony of unpleasant symptoms, including nausea, vomiting, diarrhea, and abdominal cramps. The virus spreads through contaminated food and water, contact with infected surfaces, or even through the air from vomit or diarrhea. Prevention is key in the fight of norovirus, with meticulous hand washing, thorough cleaning of contaminated surfaces, and isolation of infected individuals being paramount. According to the CDC, norovirus causes approximately 19 to 21 million illnesses annually in the United States alone, leading to hundreds of thousands of hospitalizations. Cytomegalovirus, or CMV, is a widespread virus that often goes unnoticed. For most healthy adults, infection may cause mild flu-like symptoms or no symptoms at all. However, CMV poses a serious threat to certain vulnerable populations, particularly newborns and individuals with weakened immune systems. In pregnant women, CMV infection can be passed to the fetus, potentially leading to hearing loss, vision impairment, intellectual disabilities, and other birth defects. For those with compromised immune systems, CMV can reactivate, causing serious complications affecting the lungs, brain, eyes, and other organs. According to the CDC, about 1 in every 200 babies is born with congenital CMV, and of those, 1 in 5 will develop permanent health problems. While there is currently no vaccine, antiviral medications can help manage the virus and reduce the risk of complications. Hey, you still enjoying this video? Well, if you are, make sure to hit that subscribe button and ring the bell to get updated every time we release one of these videos. All right, let's keep going. Ebola. Deep within the rainforests of Central and West Africa, a deadly virus lurks. Ebola, named after a river in the Democratic Republic of the Congo, where it was first discovered, is a hemorrhagic fever virus that strikes fear into the hearts of even the most seasoned medical professionals. Its symptoms are as terrifying as they are swift. often beginning with a fever and then headache and muscle pain, before eventually escalating to vomiting, diarrhea, and internal and external bleeding. With a fatality rate that can reach up to 90%, Ebola outbreaks demand immediate and coordinated action. Containing its spread requires meticulous contact tracing, strict quarantine measures, and the development of effective vaccines and treatments. The 2014-2016 West Africa Ebola outbreak was the deadliest in history, claiming over 11,000 lives and highlighting the urgent need for global preparedness. Thankfully, advancements in vaccine development, such as the RVSV-ZEBOV vaccine, have shown promising results in preventing future outbreaks and protecting at-risk populations. In the annals of recent history, few events have been as globally impactful as the COVID-19 pandemic. This novel coronavirus, SARS-CoV-2, emerged seemingly from nowhere, rapidly engulfing the world in a wave of illness, fear, and uncertainty. It brought our interconnected world to a standstill, shuttering businesses, closing borders, and fundamentally altering the fabric of our daily lives. Scientists all around the world joined forces, sharing data and expertise at an unprecedented scale, leading to the rapid development of vaccines and treatments. COVID-19 served as a stark reminder of our vulnerability to infectious diseases, but it also showcased the remarkable ingenuity and resilience of the human spirit. With over 700 million confirmed cases worldwide and more than 6.8 million deaths as of 2023, COVID-19's impact is undeniable. The pandemic has highlighted the importance of global cooperation and preparedness in the face of future infectious disease threats. Hey, stay informed, stay safe, and always take proactive steps to protect your health. And if you found this video helpful, be sure to check out our video on the top 12 deadliest cancers explained.